Thank you, and thank you all for coming and braving the winter storm warnings. Uh, as Susan mentioned, we are in partnership, the Solana Beach Community Connections is in partnership with the Friends of the Library, Solana Beach Library, in putting out these presentations. In the past, we've done inflation and the U.S. economy, why a war in Ukraine. Well, let me think of some of the others. At any rate, I learned that we just had approval of China and U.S. relations. That will be in September. I invite you all to come to many of these things. You will see they're advertised in the newspaper, but more importantly, we can send this information directly to you. If you could just give us your email address. Elizabeth Hospice is asking for a record of everybody who has seen this presentation. So if you could put your name and then your email address on this little 3x5 card, that would be really helpful to us. There's some program evaluations for Elizabeth Hospice. I'll try to pass some of these around while we are talking and you are listening. I want you to be aware of the fact that when we learned about hospice, we learned that there are many myths and untruths permeating, and we thought it would be really important for someone to come and give us the information directly from hospice. So we invited Sharon and Jin Lau to come, give up one of their evenings, and they are here tonight. They are with Elizabeth Hospice. Sharon has been with them for 16 years and is board certified. Her husband, Jin, has learned about hospice in two ways. His wife, his first wife, died unexpectedly in 2017, and so he and his children learned hospice from that angle, and then he has now worked for hospice for 8 years. So it's a little bit of blending of both. They'll speak for about 30 or 35 minutes, and then we'll open it up for questions and answers. So with that said, let me welcome Sharon and Jin Lau.
Thank you, Judy. Well, we are so excited to be here tonight and lovely meeting some of you already. And we love hospice and consider it a privilege to work with amazing people. We get to meet new people every day, and every day is different. So we just are going to find out a little bit about what you think about hospice and share with you what we know about hospice and what we love about it. And let's see. The way I got into hospice, briefly, I was at seminary studying with the focus on teach. I was planning to teach. And the very last thing I did in seminary at Fuller was an internship called CPE, Clinical Pastoral Education at Loma Linda University Medical Center. And that was chaplaincy. And I fell in love with it. And I was taking care, providing care for people of all ages, just all kinds of different needs that would come through the hospital. Mothers having difficulties with their babies, people coming through the emergency room. And I just fell in love with that. I didn't even know it was a field that existed called chaplaincy. So that's how I got into chaplaincy and have been in hospice, as Judy said, for 16 years. And
as Judy mentioned, my name is Jin. I was pastoring a church down in National City, and I thought, what better way for us to connect to the community than volunteer as a chaplain. Just around the corner, there was a hospital there. It's called Paradise Valley Hospital. Some of you might be familiar with that. And so I volunteered, but my wife was diagnosed with cancer, and she had to quit her job. And I said, I need additional income for us to make both ends meet. And so I said, if I could just be paid for my volunteer work, that would help us. And so I applied at Scripps, thinking I was applying at a hospital, not knowing that it was hospice. And to make it a long story short, they accepted me, and my wife later was recommended for hospice herself, which was a blessing in disguise because then I knew what to expect. And so she passed away about 6 years ago now. And it's been a rough journey, I would be honest to say that. But my sad story has become an opening door for me to talk to many people, because when I visit with them and I tell them my story, they knew that I am not operating from here, but they knew that I have walked the path myself, and that I have a special spot in my heart for people who are going through this process of hospice care and grieving. And so that has been, in a sense, a blessing. Scripps Hospice has closed. Some of you might know that, and they transferred us to Elizabeth Hospice, and that's when I met Sharon. And little did I know that there's another phase of my life that I would be remarried again. And so Sharon and I got married just at the start of COVID-19, March 2020. So this is a love story from hospice. How many of you had experience or a direct or indirect experience with hospice? Just a show of hands here. A lot. So as we start tonight, I'd like to hear what are some common. Before I start, I was working out in a gym and there was a 93-year-old Asian man, and I befriended this guy. I was very amazed because he had to show me his license saying, look, I'm really 93 years old. He was lifting weights, he was stretching, he was doing everything, he was showing off. And so we became friends. That was the time when I was still trying to impress Sharon, so I had to go to the gym. Anyway, we have met many times, and then finally about our fourth, fifth time to meet, he asked me, Jen, what do you do? And I said, I'm a hospice chaplain. And upon hearing the word hospice, he said, oh, I don't want you to be my friend anymore. Why? Because this was what he had in mind. He's 93, he's healthy, but he doesn't like this. We would like to present to you tonight that hospice isn't that scary, really. So we would want you to have this concept of hospice, that it is a celebration of life. It could be a beautiful life. So many of you raised your hand in terms of you have a first-hand or indirect experience with hospice. What are the common things that people say about hospice, if I may just ask from the audience? End of life?
Yeah, that you can only do it when it is that you are going to die.
Thank you. Yes, please.
Also, that they take the burden of care off of you.
Wonderful. Taking the burden of caring off of you so that it's the team that cares. That would be providing that. Yes.
Well, the comfort of that.
The comfort of the dying person was wonderful. Anyone else? These are beautiful. Yes, please. Support for the family and the person itself, of course. Wonderful. Yes, please. So she said the service was provided at home, but there are also differences in terms of the quality of care, depending on the company. Sure. Any last? Yes, please.
I've heard that the hospice care is free, but I'm not sure if it is. So
We can talk about that. Thank you. Yes, Tina. The counseling that she received was amazing. Lovely. Thank you. So this is our founder's, these are her words. Betty Bullen founded the Elizabeth Hospice. We encourage people to live, really live. People think that hospice is about dying, but it's really about celebrating life, just like that picture that we showed you earlier. And so we would like to give you some more details about what hospice really is.
All right, here's a few facts on what hospice is. Hospice is comfort care it's comfort care and support for people who have been diagnosed with a terminal illness and have 6 months or less to live. This is care for people of any age, children and adults. Hospice is not a place. It can take place wherever you live, home, nursing home, assisted living. If your home is your van or trailer, it can even be there, and a hospital. Hospice is holistic care that focuses on quality of life and all of the aspects of who we are as human beings. Hospice is a team of clinicians that are skilled in symptom management, pain management, anxiety control, helping somebody to breathe easier. We are all trained, not just nurses, but all staff are trained on how to observe if someone is feeling uncomfortable and advocating for them to get comfortable. Hospice is available for medical care needs 24/7. So at any time that you might have a question, you need to be able to call in and ask and talk to a nurse for help on how to keep your loved one comfortable. This is a picture of one of our patients right here in the middle. She is so precious. She's 2 years old now. So she came on when she was such a tiny little baby with lots of the children we have on hospice. And I work on the pediatric team and adult team. And Jen also has helped out with pediatric team. So we both actually were involved with this lovely family. And let's see. So yes, she came on when she was such a tiny baby and has grown. And but yeah, so you can see that care is provided for people of any age. And did you want to say something about the family?
So the parents actually were not married, and they thought, okay, this little girl, they don't know how long, but they wanted to do the right thing. And so they asked if I could officiate their wedding. They want to be married. And so that's what happened. We were at Coronado Beach. We had a wonderful wedding for them. So hospice can also have something that's that kind of story that's so beautiful, that's so unique. You can also see from this photo that a music therapist is providing care. That's one of the things that we do because the family is just so musical. Even the older girl, the daughter, she is helping the older daughter write songs and what else?
Yeah, she the older sibling of the girl who was on our service, was able to write songs that expressed what she was feeling about the situation and about her love for her family.
So let's talk about hospice myths. Myth number 1, hospice is a place, so you must leave your home to receive hospice care.
Truth is, hospice is a philosophy of care. It is not a place, and services are provided wherever you call home. Home even for homeless people, for those who live in a facility, wherever you live, we can care for you there.
There's also a myth that you have to forgo emergency services.
The truth is, you are educated to avoid using emergency services, but you do have the right at any time to call 911.
The third myth is that hospice is only for cancer.
Truth is that hospice is for any patient coping with an end-of-life terminal disease.
Mm-hmm. Here's another myth. The referring physician no longer manages the patient.
Truth is, you can choose your doctor. If you love your community doctor, you can stay with your community doctor as long as your doctor agrees to follow you on hospice. Some doctors don't want to do that. But you can ask your doctor, will you help me? Will you follow me while I'm on hospice? And they might say yes. Lots of them do.
And how about Medicare? Medicare hospice benefit lasts only 6 months.
The truth is that any patient may receive the hospice benefit as long as they are medically eligible. So somebody might end up receiving it for less than 6 months because they don't live that long, or because they get better and graduate. Or you can actually receive hospice for more than 6 months, as long as at every moment during that illness you qualify, which means that two doctors believe that if your disease runs its normal course, you would not live longer than 6 months.
Here's one of the biggest myths. Hospice hastens death.
The truth is that the goal of hospice is providing comfort, care, and quality of life. We do not hasten death. We encourage people to allow the natural process of their disease to unfold, not hastening death nor prolonging it in an unnecessary manner.
That's right. Some more myths here. Hospice patients must sign a do not resuscitate.
Truth is, you do not have to sign a DNR or do not resuscitate.
Hospice requires patients to give up medications.
The truth, patients and their physicians will choose the medications together that fulfill the patient's goals of care for a quality of life.
And lastly, hospice is only used in the very last weeks of life.
Truth is, hospice can begin when the patient has a prognosis of 6 months or less. And some people outlive their prognosis. We already discussed this, so yeah.
Yeah, you would not believe how many of our patients or family members have told us that they wish they had known this earlier and availed of it earlier so they could really benefit the services that hospice offers them. So many of you have given the concept that hospice is not just about medical nursing needs. In fact, hospice is holistic care. It provides, of course, the physical, but it also includes the mental, social, and the spiritual. The medical field has now determined that people who are going through suffering are not only suffering from physical pain, but they also have what's called emotional pain or spiritual pain. And therefore, we are approaching it in a holistic way. So what does a hospice care team look like? And Sharon will explain some more about that.
Hospice care team. As you can see, we have the patient, caregiver, and family in the center. The patient and their loved ones are the focus of care, surrounded by many people who are skilled in various ways to provide support. So we've got you have your physician, whether you choose a hospice doctor or your community doctor. You also have the hospice medical director and a hospice doctor who oversees the case. There is a home health aide who helps with bathing, a hospice nurse. We have RNs and LVNs. Pharmacist, chaplain, also known as a spiritual counselor. There are bereavement counselors to help people with their grief before the death, during difficult times, and after the death. Social workers help with resources and emotional counseling. Volunteers do amazing things. Volunteers, pet volunteers, veterans volunteers, all kinds of volunteers for companionship, to sit with your loved one so you can go to the grocery store or run some errands or just get a break. We have the Elizabeth Hospice. We also have different therapists, physical therapists, speech therapists, respiratory therapist, and a nutritionist. So I mentioned veterans. We have an amazing veteran program that does veteran pinnings. This is our volunteer here. He is very involved in helping acknowledge and recognize our patients that are veterans. And you can see that this man is saluting him back after receiving an honor for his service in the military. And you see there's a bugle. Buglers are in short supply. We actually have a volunteer that knows how to play taps on the bugle, and it's so wonderful and amazing. We have pet volunteers. These are 2 of them. And for people that love pets, this is such a comfort for them to be able to have a pet visitor.
So for hospice services, this is what is kind of a big picture here. We do provide team visits. We have medications that are related to hospice illness, medical supplies, also related to hospice illness, and then the medical equipment such as hospital bed, trays, commode, and wheelchair, and all of that is needed for a person to be as comfortable as possible. You can also think about it as a 24/7 care. We have our Connected Care phone line. We have our counseling, as Sharon mentioned, pre and during and after. And then there's the different therapies that we have. In terms of counseling, this picture in particular was ministering to, this is of different ages. It's an amazing picture because there's a younger teenager here, and they're incorporating music to help her go through her own grief process. And we do have 2 amazing places in Escondido as well as in Mission Valley where it's so geared and designed for kids to express their anger, their sadness, the whole grief process they're going through. So grief counseling is available as well for family who just could not understand why their mother was taken away from them. We also have a camp called Camp Spiro during summer where same thing, we cater to the needs of the younger ones for 5 days or a week. I've never been to one, but I've heard such good stories about Camp Spiro. So here's a question that many people ask. Who pays for hospice? Medicare, Medicare Advantage, Medicaid, Medi-Cal, private insurances. So these are who covers for hospice services. We don't ever get money directly from the patients and family members that we serve. It's always through the insurance that we get paid for our services. Oh, Sharon was going to say something about this. There might be co-pays depending on commercial insurances, or normal rules apply regarding deductibles.
And I just want to mention in the picture, you can see fidget mats made by our volunteers for people with dementia. And I had a patient who, he would always pull the tablecloth off the table and just always making a mess of the tablecloth. He loved the fidget mat when I gave him a fidget mat, and he just fiddled with that, and it was perfect. So we have volunteers that do amazing things. Whatever skill you might have can be utilized for volunteering.
For those with Medicare, inclusive benefit pays 100% for Part A of services for the service. Also, what items are not covered by hospice Medicare benefit? We don't cover curative care. We don't cover care from any provider that wasn't set up by hospice team. We don't cover prescription medications that are not related to the diagnosis, to the illness. Room and board in facilities, we don't cover that, and we don't cover for care received as a hospital outpatient. There are 4 levels of care. Oh, okay, that's right.
So this is a picture of a patient of mine with her volunteer. She would light up whenever he visited. They would sing together. She's 101 years old in that picture.
And
She did pass away a couple weeks ago.
why don't you continue the levels of care?
All right, hospice care is made up of 4 levels of care. Routine care is the most common level of care. This is usually in your home, wherever you live. Routine level of care. You get a nursing visit, a minimum of once every 2 weeks. Usually a nurse visits weekly. Some people, though, they're like, don't come unless you have to. So the minimum visit is once every 2 weeks from a nurse. And the team will just visit according to their regular visit schedules. Chaplain might visit once a month, more often if needed. Same for a social worker. Hospice aide who helps with bathing might visit 2 or 3 times a week. And visits are based on the need. So if there's a need that arises, then the nurse will come out and attend to the need. Crisis care or continuous care. Now this is when a nurse is sitting at the bedside because there is a temporary need. So if somebody is having pain out of control, anxiety out of control, respiratory distress, and the medications that are in place are not working, the nurse can come to the home, sit at the bedside, and administer new medications prescribed by the doctor in coordination with the family until the person is comfortable. So this usually lasts a matter of days, maybe 2 days, 5 days, 7 days, however long it takes to get the person comfortable. Then crisis care ends and the person would go back to routine care. General inpatient, also called GIP, takes place in a facility. It's like crisis care, except it's in a facility. So it's also a higher level of care based on need. So if somebody is having symptoms out of control, they may be able to receive general inpatient care in a hospital or in a skilled nursing facility. And finally, respite care. Respite care is wonderful. This is for people who take care of their loved one at home and need a break. Of course, all caregivers need a break. If you have to go on a vacation or you just need to travel somewhere for whatever reason, or just take care of your own medical appointments, we will provide up to 5 day stay in a skilled nursing facility for the patient while the caregiver has that break for 5 days to go and take care of whatever they need to do. And finally, our mission statement is to enhance the quality of life for those nearing the end of life's journey and for those who grieve. And just want to focus on not only the person who is ill, but also those who are grieving that person. We love and care for the whole unit, the person and their loved ones.
And their people, yes.
Okay. So we hope that after learning about hospice, you might feel warm and fuzzy about hospice like we do too. Thank you.
Do you have any questions?